This book was written by Dr. Toby Cosgrove, who was CEO of Cleveland Clinic from 2004 to 2007. Although it's geared more towards hospital administrators, and it details how they brought their clinic to a world-class health organization in the years that Dr. Cosgrove was in charge, I did like that it provided a lot of insights about how I, as a physical therapist, can influence my patients and make their experience much, much better. And I think that the lessons that I've learned from this book I can definitely carry forward into my own private practice if I choose to go that route. This chapter started off with a story about how Cleveland Clinic used teamwork and collaboration between a bunch of different specialties to save one of their patients' lives. And I think that was a really great way to illustrate how important teamwork is to healthcare especially, and then also to physical therapy, even though PT wasn't mentioned here. We are expected to work with tons of different specialties, from doctors to nurses, patients, their families, and I think illustrating how important teamwork is, not just to us, but to any kind of business organization, was really interesting to see. I also liked that they talked about how they went about identifying areas where their teamwork could improve. Getting everybody together from the lowest person all the way to the CEO to try to figure out where they could improve was a great strategy, and I think that that's something that we can definitely take forward into my professional life. The second chapter went a little bit more into detail about the specific things that the hospital did to bring everybody together and foster collaboration and innovation in Cleveland Clinic. One of the things that I really liked that he talked about was that making the physical space of the hospital reflect bringing everybody together was a way to foster innovation. So making sure that there are spaces where people from different specialties can meet, and so they meet organically and then they talk about things that affect both of their specialties can lead to more innovation. And I liked that he quoted Steve Jobs as an inspiration for that. I think Steve Jobs said that innovation happens when people meet in hallways and call each other at 10 o'clock at night. And I think that's really interesting that they've built that into their culture at Cleveland Clinic, because they really have, from what I've read in this book and then in other things, been at the spearhead of different innovations in medicine. So it seems to be working, and I think it's a good idea to take some of those things that have been mentioned in the book and pull them forward into physical therapy practice. This chapter told the story of how Cleveland Clinic implemented their EMR system. But the real point of the story was not that it helped them improve their documentation, although it did do that. It was talking about how the EMR allowed them to better monitor the quality of care that they were delivering, and then it also allowed them to dig deeper into what their patients were really experiencing. So instead of looking at each individual patient, it allowed them to see the bigger picture. So they noticed different trends in their care, and that allowed them to improve. That, I think, was really important, because I think a lot of times patients get lost in the shuffle, and taking a step back and really reviewing how you've been doing and if it's working for your patients is really important to any healthcare provider, especially physical therapists. It helps us see that although patients are each individuals, overall trends are in our care are what's really important. This chapter was my favorite chapter in the book because it talked about why innovation is important and what different things you can do to foster innovation in your own organizations and your own lives. It talked about how important it is to fail as a part of innovation. And certainly in this program, there's a lot of failures, but that's involved in learning. And it also mentioned that the Cleveland Clinic's medical school does problem-based learning. And that was interesting to me because I agree that problem-based learning really does foster innovation. It makes you think about what you're doing and why you're doing it instead of just learning a set number of facts. And to have that validation that what I feel going through this program is in keeping with the future of medicine and medical education is really nice. And it talks about how being successful involves a lot of failure and that we shouldn't be scared of failure. which I think is really comforting, especially at this point in my life. This chapter focused on how important it is for a healthcare provider to show empathy for their patients. And it started off with the author examining his own failures in showing empathy. And I think that it's really important, especially for physicians and physical therapists as well, to really examine how they treat their patients. I think, like this author, a lot of people have a tendency to say, well, my outcomes are good and my patients get better, but not really examine how they treat their patients in the moment. And for somebody that's going into healthcare, having that put in such stark detail as the story that the author told in this section did is really important, because we really are responsible for the whole patient, not just a hip replacement or a bad knee or whatever the case may be. It's what can I offer this person in terms of my ability to heal. And the empathetic and emotional and spiritual aspects of that are just as important to the patient as what you're doing for them physically. So I really enjoyed this portion of the book as well. This chapter talked about the challenges that the healthcare industry is facing right now in the face of an epidemic of chronic illnesses like diabetes and heart disease. I liked that they took time in the book to point out how healthcare, as it is right now, is a sick care industry, and that the future of healthcare is more well care. And I liked that they talked about how a lot of responsibility for that rides on the patient taking charge of their own healthcare. I've always said that one of the things that I liked about physical therapy was that it was giving people the tools to heal themselves. And I think that well care in the future will be a really big part of that, so I like that they took time to discuss that in this book. This chapter was my least favorite chapter of the book. It seemed a little bit repetitive. They repeated a lot of the points that they had made in the previous chapters, and then it also seemed a little bit dated. They talked about how home health physical therapy is now preferable to long hospital stays after joint replacements, and in my experience at least, that's been the case in almost every joint replacement that I've seen. So it seems like this section in particular could use some updating if they were to ever release another edition of this book. But other than that, it just made a lot of the same points, and it seemed like it didn't really need to be in the book. This chapter was really interesting, even though a lot of the points that they made here don't really apply to physical therapy. It was interesting to me personally because they talked about how a lot of the future of medicine is personal medicine based on people's genome, which I find interesting because I just think the science behind it is really, really, really cool. Obviously, genome wouldn't really play a huge factor into physical therapy because we're more focused on what people are presenting with right now. But I did like that they talked about how genomics has the ability in the future to let people take charge of their own healthcare. And that's a point that they've made throughout the book, is encouraging patients to take charge of their own healthcare, to talk to their doctors. So having that repeated here again, I think was an important message to lay people that are reading this book to get, even if they don't understand the science behind what they talked about specifically in this chapter. Overall, I really enjoyed this book. I liked that it encouraged healthcare professionals to collaborate more. I liked that it encouraged patients to communicate with their doctors, especially when they have something that concerns them that they don't think that their provider is listening to. And I liked that it talked about where healthcare is going in the future, because obviously that's going to be a huge part of my life going forward, and it's interesting to see an industry expert's perspective on it. I didn't think that I would really enjoy this genre, but I definitely would like to check out more books. So that's it.